Let's begin with the first section of our lecture, and in this section we will talk about the clinical manifestations of infectious diarrhea. What's the pathogenic mechanism associated with the infectious diarrhea, and also we will talk about the role of the toxin which is produced by some microorganism that lead to infectious diarrhea, and also the invasion which can cause infectious diarrhea. So let's begin with the section. And in this diagram here you can see the diarrhea may be caused by bacteria or parasite found in food and water. These are the bacteria. One very common cause of infectious diarrhea is the in eating food that is contaminated, drinking water that is not clean. So very, very important is the eating and drinking water that is contaminated. So contaminated food and water which has microorganism can cause, once it's ingested, cause different pathogenic mechanism which we will discuss in this section, and can cause diarrhea. Leading cause of illness globally, very, very common cause of illness, very common cause of morbidity associated with acute infectious diarrhea, but also in cases when the treatment is not properly done and or the treatment is not properly available, it can cause death also. So it's a leading cause of illness globally. Children usually less than 5 years are more affected. Their immune system is weak also. So these are the children who are prone to acute infectious diarrhea. It's only second to lower respiratory tract infections. Lower respiratory tract infections are also very common infections in children. So the diarrheal, infectious diarrhea is second only to the infection of the lower respiratory system. So it's second infectious disorder which is common globally. Recurrent infection, repeated episodes of acute infectious diarrhea can also occur, and the risk factors associated with the recurrent infection are the physical and mental stunting. People who are disabled, not strong enough physically and mentally, they are prone to recurrent infection. The common factor that can be is poor hygiene, poor control of, so they usually eat or drink the contaminated food is common with them. They can eat food that is not fresh also. Old food is more likely to have microorganisms. So all these factors can be the leading cause, but they are physically and mentally not strong and they are weak. Wasting, weak and wasted people. Wasting is another factor associated with the recurrent infection. Micronutrient deficiencies, different deficiencies in the nutritional deficiencies can also lead to recurrent episode of the infectious diarrhea. And same if there is deficiency of malnutrition can occur as a result of dietary deficiency. People who are malnourished, they are weak, they have recurrent episodes. Again, the factor in this malnutrition is also weak, debilitated people, and they have not strong immunity to protect their body against different infections. All these factors can lead to recurrent infections or recurrent infectious diarrhea episodes. So these are some common, and again, it's second common cause of infection or leading infection after the respiratory tract infection. Clinical manifestations associated with this. This is a chart that gives different sites of infection, how the mechanism, whether it's inflammatory, non-inflammatory, penetrating type, and what are the findings in the stool which are present if the stool examination is done, and also just some different microorganisms commonly associated with those mechanism. So it's a very, very good comparison. We have mechanism can be non-inflammatory, and this is due to enterotoxin that is produced. Then we have inflammatory type, which is due to the cytotoxin and invasion. And then we have third, which is the penetrating type. So three mechanisms are mainly associated with the acute infectious diarrhea. It can be non-inflammatory, inflammatory, and penetrating. So three types. Location is proximal small bowel. We have colon or distal small bowel, and then distal small bowel. So in the non-inflammatory, it's mainly proximal small bowel, and small bowel we know is duodenum, which is the first part. Then we have jejunum and ileum. So if this is proximal small intestine, so more likely it is affecting duodenum and a part of the jejunum also. So that is involved in the non-inflammatory type of diarrhea. It's watery diarrhea. In non-inflammatory, the watery diarrhea. These are very important questions we should ask the patient who come with the history of diarrhea, whether it's watery diarrhea or if there is blood in the stool or there is mucus in the stool, and that gives us the idea what can be the causative agent. So diarrhea is watery diarrhea. In stool findings in non-inflammatory type, no fecal leukocytes. No leukocytes or white cells are present in the stool because it's non-inflammatory. White blood cells or leukocytes are commonly present in inflammation. So no fecal leukocytes. There is mild or no increase in fecal lactoferrin. And the pathogens that can cause non-inflammatory type, we have Vibrio cholerae, enterotoxigenic E. coli, then we have enteroaggregative E. coli. So E. coli is very common pathogenic organism. Then we have Clostridium perfringens, Bacillus cereus, Staphylococcus aureus, Aeromonas hydrophila, Plasmonas shigelloides, rotavirus, norovirus, enteric adenovirus. So different viruses, different bacteria, and the parasites can cause non-inflammatory type of diarrhea. It is watery diarrhea, no leukocytes present, and very mild or no lactoferrin present in the stool. Second type is now the inflammatory type, in which also known as invasion or cytotoxin. In the first, we have enterotoxin. In this, cytotoxins is caused by invasion of the lining or by the production of cytotoxin. And here the location now is both the colon or the distal small bowel. Distal small bowel now will be more ileum and the distal part of the jejunum, and the colon large intestine is also affected by this. The type of diarrhea is dysentery. With the diarrhea with the blood is dysentery or inflammatory diarrhea. There are polymorphonuclear leukocytes, white blood cells are present in the stool, substantial increase in fecal lactoferrin. So now we can tell the difference between the non-inflammatory and inflammatory very clearly by examination of the stool, by the type of the diarrhea that is present. And then the causative pathogenic organism, again, we have Shigella, Salmonella, Campylobacter jejuni, enterohemorrhagic E. coli, enteroinvasive E. coli, Yersinia enterocolitica, Listeria monocytogenes, Vibrio, Clostridium difficile, Shigelloides, and amoeba. So all these are different pathogenic organisms that can also cause the inflammatory type of illness. Then the last type is penetrating. Now it is actually invading, penetrating, small bowel disease. Its enteric fever occur as a result of penetrating mechanism. Fecal mononuclear leukocytes are present, and this type, enteric fever, is caused by Salmonella typhi and Yersinia enterocolitica. We know now penetrating illness is now only limited to two microorganisms that commonly cause enteric fever, and that is Salmonella and Yersinia enterocolitica. So these are different microorganism, different difference between the type of diarrhea associated with inflammatory, non-inflammatory, and penetrating type of illness. So very, very good and comprehensive description of the differentiation between the three types. Now in the pathogenic mechanism, let's talk about what's the inoculum size. Inoculum size is how many microorganisms are required to cause the disease in the first place. So inoculum size is microbes ingested to cause disease. Some microorganism we need only few to cause a disease, some we need more to cause a disease. So depending on what is the inoculum size is associated with different microorganism. So we have it vary from species to species depending on virulence of the microorganism and vulnerability of the host. We have different, it varies from species to species. So the pathogens like Shigella, enterohemorrhagic E. coli, Giardia lamblia or Entamoeba. These microorganisms we need only 10 to 100 bacteria or cyst can produce infection. So 10 to 100, it's not a big number it required to cause infection. Then Vibrio cholera, and Vibrio cholerae, the microorganism that can cause cholera. In the old days, cholera is one of very common illness that leads to so many deaths because it involves the population and the treatment was in the beginning was not very effective. So we tend to the power of 5 and 8 organisms required, so they need a big number of microorganisms to cause infection. Then the Salmonella. Salmonella, infective dose of Salmonella varies depend on species, host, food, vehicle. Usually the Salmonella infection is associated with the old, refrigerated, contaminated foods and depends on the virulence of the causative organism, different types, and then we depending on the immunity of the host and also the type of the food that is utilized, food vehicle. and it grow in food before reaching infective dose. So the food we utilize sometimes which is infected by salmonella, it grows in the infected food, and then once it ingested, there is already infective dose present in that contaminated food, and it can cause infection. We said enteric fever, typhoid fever, those are commonly caused by the salmonella infection. E. coli and amoeba giardia spread by person-to-person contact. So E. coli infection and amoeba giardia, these are all the infections from person-to-person contact. So person who has infectious diarrhea need to be isolated, should not touch any food particle, anything, so it should not be transmitted from one person to another. So that's the mode of transmission of E. coli and amoeba and giardia. Now, how these microorganisms, or what's the pathogenic mechanism associated with adherence of microorganisms to the intestinal wall? Here, if you see, this is the normal microbiota, normal flora of the intestine. This is the mucus present. Then we have the Clostridium difficile, which are the pathogenic microorganism. Then we have epithelial cells are present, and this is the pseudomembrane. And here the Clostridium difficile, you can see it is attached or adherent to the lining. So many organisms adhere to gastrointestinal mucosa, initial step in pathogenesis. So different microorganisms, once they reach the intestine, they adhere to the mucosa, and from there the mechanism of infection starts. Advantage for disease causing organisms, they compete with normal flora, and they cause colonization of mucosa. So pathogenic microorganisms, here you can see there are a lot of normal flora present in the intestine also, and once the pathogenic microorganisms, they adhere to the mucosal wall, they have to fight that normal flora to cause infection. So they compete with the normal flora, and then they cause colonization of the mucosa. Specific cell surface proteins are present which initiate the adherence. So specific cell surface proteins are for the virulence determinant of if there are protein receptors present to which these pathogenic microorganisms adhere. This is an important factor that tells the virulence of the causative microorganism. Next, let's go over the adherence of different microorganisms that can cause infectious diarrhea. First, we have Vibrio cholerae. They adhere to the brush border of small intestine enterocytes. So they adhere to the brush border. Brush border, once they affect the brush border or the cilia, the purpose of that is to clear the microorganism and that gets affected and damaged, and most likely there is increased vulnerability of the host to the infection. So they adhere to the brush border of small intestine cells. Then we have, they again adhere, we already mentioned, they adhere through the specific surface adhesions are present to which they attach, including toxin, coagulated pilus. So all these are the mechanism how the Vibrio cholerae attack, or it attaches the brush border of the small intestinal cells, and then it adheres through the adhesins present, and it start the mechanism of toxin and cause infection. Other accessory colonization factors are also present. Then other is the enterotoxigenic E. coli. E. coli cause watery diarrhea, produces colonization factor antigen. So here again it produces the antigen that is responsible for colonization, and also cause colonization of upper small intestine, proximal small intestine, prior to production of enterotoxin. So here also E. coli, as it shows, enterotoxigenic. So it functions by production of enterotoxin that is responsible for causing infection. Then enteropathogenic E. coli, it is responsible for causing diarrhea in young children. Enterohemorrhagic, you can see all these microorganisms, some of them are also self-explanatory, their names are self-explanatory. Enterotoxigenic, enterohemorrhagic. In hemorrhagic, hemorrhage is there and they produce the blood comes out and blood cells. So, and then we have enteropathogenic, mostly in young children. Causes hemorrhagic colitis or inflammation of the colon or large intestine. Cause hemolytic uremic syndrome also, which is caused by enterohemorrhagic E. coli. Produce virulence determinants. These are the characteristic features of enterohemorrhagic E. coli. And there is attachment and efface brush border of intestinal epithelium. So here it affects the brush border of the brush border, like we mentioned in the Vibrio cholerae, which also cause attachment to the brush border and then cause its destruction and proceed. So that's all the mechanism of different common microorganism, pathogenic organism of acute infectious diarrhea and how they can cause the infection. Next, the toxin production. Different microorganisms we mentioned, they produce cytotoxin, they produce enterotoxin. So production of the toxin is very important in the pathogenesis, in the development of infectious diarrhea of enteric organism. E-N-T-E-R, enteric is anything pertaining to the intestine. Enteric is the term used for intestine, so enterotoxin for the toxin in the intestine. So pathogenesis of enteric organism. Enterotoxins, we have cause watery diarrhea, acting directly on secretory mechanism in the intestinal mucosa. So it causes watery diarrhea because it increases the secretion by the intestinal mucosa. Cytotoxins. Cyto is for cells, so cytotoxins cause destruction of mucosal cells. So you see a lot of these terms are all the self-explanatory and they are associated with inflammatory type of diarrhea. And remember I said that inflammatory diarrhea, there is increased number of leukocytes, white blood cells in the stool, and there is also the another feature, there is increase in the lactoferrin level present in the stool. Then we have neurotoxins, act directly on central and peripheral nervous system. Those are the neurotoxins. So these are different toxins produced by pathogenic microorganisms that can cause the acute infectious diarrhea. Next, we have prototypical enterotoxin, which is the a cholera toxin, and it has 1A and 5B subunits. So, prototypical enterotoxin, which is the cholera toxin. A subunit of the cholera toxin, which has 1A and 5B subunit. What are these subunits? A subunit contain enzymatic activity of toxin. So these subunits, which has 5 subunits, what's the function of these subunits? They contain enzymatic activity, means they have destructive ability, function as enzyme, which has the ability to perform different chemical reactions that are associated. So enzymatic activity of toxin is in the subunits. B subunit pentamer, they binds to the holotoxin to ganglioside GM1. So A subunit of the cholera toxin contain enzymatic activity, and B subunits, they binds to holotoxin to ganglioside GM1. So these are the functions of A and B subunits of the cholera toxin. Holotoxin binding, what it does is we mentioned is associated with B subunit. Holotoxin binding cause translocation of A subunit. Adenosine diphosphate ribosylation catalyzes, and there is persistent activation of adenylate cyclase, increase of cyclic adenosine monophosphate in the mucosa, increase the secretion of chlorine, and decrease sodium reabsorption. So decrease in the reabsorption of sodium and increase secretion of chloride. So both are increasing in the is getting rid out of the intestine, because increase in the secretion of chloride and decrease in the reabsorption of the sodium. Loss of fluid occur, and this cause production of diarrhea. So that's the mechanism which is associated with the toxin production. Cholera toxin we mentioned here, which have A subunit and have B subunit, and how these subunits function. They have the activity which cause the reaction in which adenosine diphosphate catalyzes, and it causes activation of adenylate cyclase that increase the cyclic adenosine monophosphate, and then it causes increased chloride, decreased sodium reabsorption, increased loss of fluid, and can cause watery diarrhea. Next, enterotoxigenic strain of E. coli. We have some enterotoxigenic strains produce heat labile enterotoxin, LT, heat labile enterotoxin. Heat labile means it can be destroyed by the heat. Then we have heat stable enterotoxin, which is not affected by the heat. Similarly to cholera toxin, it can cause secretory type of diarrhea. So some enterotoxigenic E. coli strains can have heat labile enterotoxin, and they produce the watery diarrhea like cholera toxin. Then we have some are heat stable enterotoxin. One form causes diarrhea by activation of guanylate cyclase. So these are the mechanism of action of different enterotoxins produced by E. coli, which can be heat labile and heat stable. Elevation of cyclic guanosine monophosphate. So mechanism of action of this is pretty much the same as the cholera toxin by activation of guanylate cyclase that cause increase in the production of the guanosine monophosphate. Some strains of E. coli can produce both heat labile and heat stable enterotoxin. Next, bacterial cytotoxins. Cytotoxins destroy the mucosal cells. These are all the pictures of different microorganisms. So the cytotoxins, which as the name shows, they destroy the mucosal cells, produce the syndrome of dysentery, and they have destruction of the blood, can cause the hemorrhage, or there is blood in the stools also. Bloody stools with inflammatory cells, there are neutrophils, leukocytes present in this type of infection. Enteric pathogens are the Shigella dysentery type 1, Vibrio parahemolyticus, Clostridium difficile S dysentery type 1, and Shiga toxin producing strains of E. coli. So all these are different enteric pathogens which are the bacterial cytotoxins. Outbreaks of hemorrhagic colitis and hemolytic uremic syndrome are associated with bacterial cytotoxins. Next, the neurotoxins, we said they affect the central nervous system and peripheral nervous system, usually produced by bacteria outside the host. Cause symptoms after the food is ingested, after the microorganisms are ingested, they cause infection. Examples are staphylococcal and Bacillus cereus toxin. These are all the neurotoxin producing organisms. Act on central nervous system to produce vomiting. Invasive type, we have dysentery from production of cytotoxins. Bacterial invasion occur, and this invasion can also cause destruction of intestinal mucosal cells. Shigella and enteroinvasive E. coli cause invasion of the epithelial cells, and then it causes multiplication in the epithelial cells, and then from there it spread to adjacent organ. So that's how the invasive type of microorganism, which are Shigella and enteroinvasive E. coli, they attack the cells and then slowly spread to the different cells around them. So all these mechanisms, we talked about them in detail. We talked about cytotoxins, neurotoxins, microorganisms that function by invasion or penetration, and then the ones who have enterotoxin production, and they can cause infection like cholera toxin and then E. coli. So different mechanisms are associated with the infectious diarrhea, but if we summarize briefly, mainly it's because of the sometime production of the toxins, enterotoxin, cytotoxin, neurotoxin, or it can be by the invasion. And then we have three types. We have inflammatory, non-inflammatory, and invasion. And then we talked about the difference between these three types and what the causative organisms and how the appearance of the stool is associated with these. Then the salmonella, again, it causes inflammatory diarrhea. It comes under the invasive type of microorganism. And then invasion of the bowel mucosa, not associated with enterocyte destruction. No clinical syndrome of dysentery. Then we have Salmonella typhi and Yersinia enterocolitis. They also are the penetrative type. They penetrate the mucosa, multiply in the Peyer's patches, multiply in the lymph nodes, cause headache, fever, relative bradycardia, abdominal pain, and splenomegaly and leukopenia. So it's little severe type enteric fever caused by the Salmonella typhi or the typhoid fever. There is splenomegaly, enlargement of the spleen, a pain in the abdomen. So it's a bad condition as compared to just simple infectious diarrhea and should be managed and treated properly. So that was all about section 1. Thank you for watching sqadia.com.